Now, a lawmaker appeals to the IATF to allocate more COVID-19 vaccines for Cagayan de Oro City. The OCTA Research Group earlier classified the city as an area of concern after it reported a 75% spike in infections. We now go above and beyond the headlines with Cagayan de Oro 2nd District Representative Congressman Rufus Rodriguez. Rufus, good evening po, and thank you for joining us. You sound very worried in that letter where you appeal for more vaccines for the city.
Yes, good evening, Pia. And yes, the UP OCTA Research Group already said, and they mentioned three cities of areas of concern. And the first one is Cagayan de Oro City, and that 75% spike. And so records would show that in the past days, like May 10, 53, May 11, 24, May 12, 123 new COVID-19 cases, and yesterday was 98. So what we see here is that Cagayan de Oro would need additional vaccines to be able to make sure that we go now from the A2, A3 to A4 and then A5. In other words, reach them ahead of any contamination. So that is why we would like to request. I have two letters to Secretary Duque and Secretary Nograles. I appeal to Vaccine Czar General Galvez for more vaccines for Cagayan de Oro.
Mm-hmm. Yes, Congressman Rufus, ano po ba yung capacity ng hospitals ninyo ngayon sa Cagayan de Oro City? Like, tell us, how many people are confined in the COVID wards, COVID ICU in Cagayan de Oro City. Nasa critical level na ba at nag-aalala na talaga kayo? And at the same time, can you also tell us, do you have the data of the population of Cagayan de Oro City? What percentage has been vaccinated already?
Well, first, yes, we have now almost reaching capacity. The Northern Mindanao Medical Center has 68 patients. That is the regional hospital, public hospital. Other hospitals also are getting increased admissions because of the COVID-19. In fact, there's also a problem of medicine like remdesivir, which is being used. And so that is correct. And as far as the vaccination is concerned, it is going smooth. But the supply is lacking. They have started 3 days ago the seniors and comorbidities. And now, recently, the other day, they have started with a second dose of our frontliners. And that is good news because that is already reserved. But what I mean is that there has to be already a vaccination for the A4. The A4 will be those who are working in essential industries and essential services like transport. They have to be given already, and there is still no vaccines for them. And then A5 will be the indigent population, not included from 1, which is the medical frontliners, including the hospitals, public and private, and then the barangay health workers, and then 2, the seniors. Most of them, Cagayan de Oro, have already been vaccinated and comorbidities. But the A4 and A5, we want to make sure that they have the vaccine already. They have their jobs because the contamination is quite fast and the spike. So that is what we have now, Pia, and we hope that the IATF will listen to the plea of Cagayan de Oro, one of the battleground cities now on COVID-19 contamination.
Yeah, battleground, very apt this word to describe what's going on there in Cagayan de Oro City, sir. I wanted to ask also kung because hindi lang naman sa Cagayan de Oro yung issue ng supply and shortage of vaccines, but also like for example here in the NCR plus area, ang nangyayari po dito in the last few weeks is kapag hindi nakahanap ng ospital within NCR, lumalabas nasa probinsya, Pampanga, Laguna, Bulacan, gano'n, ano. Is that what is also happening, sir, in CDO kapag walang makuhang hospital bed or kwarto or ICU, lumalabas ang tao from CDO?
No, so far naman, we have very good private hospitals also. We have two public hospitals, and we have the Northern Mindanao Medical Center, and we have the J.R. Borja Memorial Hospital of the city. And so far naman, they still have some space, although it's getting to be tighter. And private hospitals are there, and they have been able to admit. And so as of this time, the hospital situation in terms of rooms are still quite capable to handle this increase. But as I have said, it is better to already have more vaccines from IATF so that we can give jobs and vaccination to many more from the A1 to A5, so that there's already a protection for them. Because once you have the first job, you cannot be hit hard. You will be it will be a milder case in case you are contaminated. So that is really the request of our city government and the people of Cagayan de Oro, that because while many local government units would require more, but we have to look at the data, like what our UP OCTA Research Group has said, that these are areas of concern. And I can mention, for example, Cagayan de Oro is number 1, number 2 in the report was Puerto Princesa, and number 3 was Bacolod City. So there should be some consideration in giving more to these battleground cities. Yes.
Yes. Well, we hope things do get better, sir. Congressman Rufus Rodriguez of the city of Cagayan de Oro, thank you very much for joining us, sir. Coming up.